Hi guys, today we're going to talk about marijuana or the plant that it's made from, which is called Cannabis sativa. The plant is used to make marijuana. It uses the dried flowers, seeds, stems, and leaves. It is classified as a mild type of a hallucinogen, which means it alters your perceptions of and it is also acts as a depressant where it can slow down the functioning of your brain or also as a stimulant speeding up the functioning of your brain. The active ingredient in marijuana is THC or tetrahydrocannabinol, and this is the ingredient which gets people high. And there are higher levels of THC today in the marijuana being used at 28% as compared to the marijuana that was used 30 years ago, which only contained about 2%. Marijuana is illegal by federal law, and federal law overrides any of the state laws. But some states have legalized the recreational use of marijuana for people ages 21 and up, but the recreational use in Connecticut is illegal. If you are arrested for possession of a small amount of marijuana, first-time offenders will get a fine and possibly no jail time. But if you are arrested for larger amounts or for sale of marijuana, this is a felony which will result in fines, jail time, and is put on your permanent record and can limit your ability to attain future jobs. Pot is illegal for teens in every state. There are legal consequences. There are academic consequences, which could lead to, even though it didn't happen in school, whatever happens out of school gets reported to school, and this could lead to you being suspended or expulsion. And having this happen could limit your ability to get accepted into college, being eligible for college financial aid, and again, limiting your ability to have a certain type of a job when you're older, for example, like being a lawyer. CBD or cannabidiol is the second most prevalent chemical, and it does not have a mind-altering or addictive properties. You have to be 21 or older to purchase CBD-only products, and some people say that they make them feel calmer or help with pain. Health risks related to marijuana with recreational use long-term, we don't know what the effects are going to be. It hasn't been legalized long enough to be able to know. It's similar to when we first legalized tobacco. We didn't know what was going to happen there with the health risk, and of course we do know now the dangers of tobacco smoking and using tobacco products, and now causes about 6 million deaths a year. This will probably also happen long term with recreational use of marijuana. We do know that there are 50 to 70% more cancer-causing chemicals in marijuana than there is in tobacco smoke. And we do know that marijuana use does increase the rate of anxiety, depression, and schizophrenia. Schizophrenia is a mental disorder where people hear and see things that are not really there. Marijuana use does impair your coordination. It slows down your reaction time. It distorts your perceptions of time and space and is very dangerous and makes driving difficult. And you can be arrested for driving under the influence of marijuana as you can alcohol and other drugs. Marijuana use for teens is dangerous, and this is a known fact. Your brain, as you know, we've been studying, does not fully develop until you are 25 years old. And what happens is it using this chemical rewires your brain, making connections in the wrong places. So it makes your brain send out wrong messages. And we know that this can impact your IQ. It impairs your ability to remember and concentrate, which can lead to poor academic performance. It affects your ability to make good decisions and affects the part of your brain that helps you with judgment. It leads to addiction. People do get addicted to marijuana after using it and they stop using it for a long time. They can feel very depressed. They feel like they can't eat, they can't sleep. And we do know that it tends to lead people to using other types of drugs. And of course, it has an increased risk for depression, paranoid thoughts, anxiety disorders, and other mental disorders such as schizophrenia. Um, they they know that if you have a maybe a susceptibility to developing something like schizophrenia, just using marijuana once can set off a schizophrenic type of episode, and you can get develop schizophrenic disorder as a very young age, and it might have been something that would never have happened if you had never used the drug. We also know that marijuana smoking damages your lungs. And as I said, when there are more studies on long-term recreational use with the legalization, we'll probably see many of the same effects that tobacco smoking has, as with marijuana smoking. Edibles is food that's infused with cannabis or marijuana. It's a serious risk for overconsumption or overdosing. It takes a long time to feel the effects of a person when they're using edibles. When you any drug that you smoke or inhale, the effects of that drug reaching your brain is very quick. It's less than like 5 or 10 seconds. And of course, anything that you eat takes about 20 minutes really to break down. So it takes a while to feel the effects. And because people think it's not working, this leads them to eat more of the edible containing the marijuana, which can lead to having all of this kick in at one time. The THC kicks in all at once, causing people to feel nauseous, have hallucinations, which are pretty scary. And symptoms of overdosing or overconsuming would be having vomiting, psychosis, hallucinations, meaning seeing things or hearing things that aren't there, panic attacks, paranoia. If you have a friend that smokes or eats too much cannabis, then what you should do is, it's a medical emergency. You should get help from an adult immediately. If you cannot find an adult right away, then you should call 911. Don't worry about getting in trouble. Just call 911 and help your friend out. Vaping cannabis is very dangerous. You're inhaling more than just THC when you're doing this. The vapor contains dangerous chemicals and tiny metal particles that can settle down in your lungs and cause inflammation, making it hard to breathe. And since March of 2019, so just a little bit over a year ago, more than 2,000 people have gotten sick, and 39 of them have died from vaping cannabis. And it's likely that the cause of this is vitamin E acetate, which is a thickener that illegal sellers add to THC-laced cartridges. So whenever you're buying anything that's not from a pharmacy or sold over the counter, you never know what you're getting. And when people are buying vaping cartridges, which have had THC added to them, you also don't know what else is added to them. Of course, you don't know the amount of THC that's added to them. And of course, and this is what is causing the problem, people have been had to be put into comas and put onto respirators. And again, like we've had 39 people have died. Many of them are very young people. So it's a very dangerous thing to do. Medical marijuana is something that was passed in Connecticut in 2012. And at that time, it was only for the use by adults, not for minors. It's not a cure, but it's palliative care. And palliative care is when you treat people for chronic or painful or serious illnesses, and the goal is to not cure them, but rather to help them feel better. It prevents or treats the symptoms of the disease itself or of the treatments that they're going through. And palliative care also treats emotional, social, practical, and spiritual problems that illnesses can bring up. And when the patient feels better, they'll have an improved quality of life. It can be given at the same time as treatments to cure or to treat diseases, and of course also at end of life situations. The Connecticut State Department of Consumer Protection is in control of the medical marijuana program in Connecticut. The link is there up on the screen. People who can qualify to become a medical marijuana registered patient, and you go up onto that link, and the requirements are that one is that you are a Connecticut resident, that you are being treated by a physician or an APRN or an advanced practice registered nurse. And you must have a debilitating medical condition that has been approved for participation. There is about 31 different debilitating diseases or conditions that have been approved at this time for adults. And you cannot be an inmate or in a correctional facility. And the registered physicians or APRNs are doctors who have signed onto the program to be a part of being able to refer their patients that feel that other ways of treating the person haven't worked. So this is kind of like a last resort of something that they could use to help them feel better. It's not a cure, but may help alleviate pain or help them take away other symptoms that they may be having for treatment that are just symptoms of the disease that they have. Medical marijuana has been approved for minors in 2016. You must have a guardian appointed to register the minor patient, and you need two physicians to confirm the palliative use for minors. One has to be the primary physician that takes care of the patient, and then also the specialist who is treating the minor for the debilitating condition in which they have. And they also have a letter confirming that this is the best interest for this minor patient, and that all other sources of treatment have not been working. And so this, they feel, would be the next step to help them. It's been approved for 10 different debilitating conditions in minors. And like I said, there's 31 for adults. And those are listed up on the Connecticut website link that's on the last slide. Rules to help control palliative use of marijuana are put in place, and that is a good thing. One is that patients have to re-register and renew their registration every year, which means that their doctors would have to sign off and say that, yes, this is something that should be continued. There's a limit to the amount of marijuana that can be dispensed each month to the patient. So the amount that each patient is getting is limited. It is also limits to where the marijuana can be used. And the medical marijuana is not in the form of anything that is smokable, but rather is in a form of an oil that produces no high. So it's a different type of medical marijuana than is used for adults. And the marijuana has to be obtained from approved dispensaries. Dispensaries are facilities registered by the state that will basically like fill a type of a prescription for marijuana, and this is where the control is with the amount they're given, how much is given out, and of course all the rules and regulations related to where it can be used, and that sort of thing. And if if you don't abide by those laws, are all again listed up on the Connecticut website. Because something's legal doesn't mean it's safe. We have lots of things that we can think about that are legal but may not are necessarily good for us. We know that with tobacco, and we already mentioned that. We know that it makes people sick and shortens people's lives. And it's not something that's healthy or good for us to do, but people still do it. We know that it's legal in Connecticut to ride a motorcycle without a helmet, but is it safe? Is it good for you? No, there are many other things I'm sure that you can think of that are legal that we can do, but they may not necessarily be good for us. And this is the same thing with the recreational use of marijuana being passed in some states. It doesn't mean that it's safe or that it's good for you or without consequences, health consequences. Legal consequences, if it's approved recreational use in the state, okay, no legal consequences, but there are definitely health consequences there that we are not aware of yet. And knowing that some states have legalized the recreational use for adults of marijuana and having medical marijuana programs approved can be misleading for teens and for youth. They may not understand, well, if we use this to treat diseases, how could it be bad for you? Well, the treatment for diseases is not treatment to cure anyone. It's something that can help alleviate pain or take away symptoms that patients have with these chronic long-term diseases or in end-of-life types of situations for people, but it is not a cure. And it's not something that we're saying is necessarily that's good for people, but using the marijuana, the risk of that is better than the pain that people might be enduring through normal treatments. And like I said, we still don't know what long-term recreational use of marijuana will, health consequences will occur. We do know that that there are 50 to 70% more carcinogens or cancer-causing chemicals in marijuana than there is in tobacco. And we definitely know that marijuana is harmful to the teenage brain. It lessens your attention and memory and judgment. It increases your risk for lifelong addiction and to have lifelong problems with mental disorders. And these are facts that we do know. So marijuana is not for teens. Recreational use of marijuana long term, we do not know the health consequences. We know that people should not be using marijuana in driving. And medical marijuana is legalized in the state of Connecticut, and it is to help lessen pain and discomfort for people suffering from any form of approved disabling type of a disease, but it is not a cure. Take care, and don't forget to read the article and that is also linked on your Google Classroom assignment from Choices Magazine with cannabis. What's the deal with cannabis? And then there is a little short little quiz that you're going to take at the end. Hope to see you guys soon. Stay safe. Practice social distancing. Make sure you're washing your hands. Keep your hands off your face. And it'll help us all be able to get back together again soon. Take care. I miss you all. Bye.